two structures, the ovarian ligament and the round ligament, are homologous to or equivalent to what male structure?
Gubernaculum textus.
Gubernaculum. Or some people are hitting, the ones that are talking away are hitting
That's
out of the
right.
ballpark.
We be
And
studying.
then from the ovary,
Is it the upper or lower?
this would be the lower. And this one's suspending the ovary.
The suspensory.
And that is homologous to the upper gubernaculum in the male. That is no longer present. It's degraded in the adult male. Two other ligaments that we covered.
What does the ovarian suspensory attached to? Suspensory ligament?
The suspensory ligament is attached to the ovary.
The other
This is going up to the posterior abdominal wall.
Oh,
And put the oviduct in there.
What else? The bladder? Oh, yeah. I'm stupid. I'm sorry.
Remember those three structures I talked about associated with the lateral aspect of the fundus? The round ligament, the oviduct, and the ovarian ligament. And what were the other two ligaments? This one and this one.
uterosacral?
Okay, so we have the broad ligament formed of the mesometrium, mesosalpinx, mesoovarium. So this would be the broad ligament, all the mesos. And then we have the uterosacral ligaments.
Like her oviduct. Like,
Okay, attaching to the sacrum. All right, so now let's look at the layers of the uterus. This turned out so well in the morning class, I decided to do it again. So when we look at the uterine wall, what was our root word for uterus? No, that's oviduct. Root word. Metrium. Exactly. So if we take this peritoneum that is attached to the external surface of the uterus, it is defined as the outer layer which is the perimetrium. You can't see it here because it's cut off in the histology slide. That's the serous membrane, peritoneum. Anybody remember what tissues form a serous membrane?
Right over this one. Oh,
No, about tissues. What kind of epithelium? Simple squamous. And loose, irregular connective tissue secretes this serous fluid. So just looking at the uterus, its surface, when you touch its surface, that's what you're touching, is the perimetrium. Okay? Then we have the wall of the uterus, which is made up of smooth muscle.
Quick question.
Uh-huh.
Does it matter if you put loose areolar or?
Areolar is fine. I use loose irregular because then I can show a graduation between loose irregular and dense irregular and dense regular. But areolar is fine. It's a legitimate term.
Okay, I'm not familiar with this irregular.
With loose irregular?
The dis irregular?
Dense. irregular. So you have loose irregular where the collagen fibers are loose, and then you have dense irregular like the reticular layer of the skin where you have dense components. So the next deep layer is smooth muscle. Myometrium, exactly. Myo being one of our prefixes for muscle.
I don't know why
I wanted
it's
to
all
write that
one
second.
color.
Anybody ever heard of fibroids? Okay, those are typically benign, meaning they don't metastasize, but a hypergrowth of the smooth muscle, forming knots. It can make it difficult for the menstrual cycle, so women often have abnormal bleeding. They can be small, microscopic, or they can be golf ball, baseball, cantaloupe size. And if there's lots of them, they come back, so a woman may end up just having a hysterectomy, well not just, but having a hysterectomy rather than trying to remove them individually, and just, especially as she's done with childbearing. And then the innermost lining, endometrium. And as a tissue, this is simple columnar epithelium. It's folded and forms uterine glands, and both loose and dense irregular connective tissue.
What about the myometrium?
The myometrium is smooth muscle.
Oh, sorry.
Yeah, it's loose right up at the top and becomes denser. It's just like skin. The papillary layer of skin is the dermis. The papillary layer is loose, and the reticular layer is dense. So we have this gradation where it becomes, the collagen bundles become thicker and closer together as it becomes more dense. So if I turn these lights off here, down here would be the myometrium, okay? And from here on up is the endometrium. And you can see this really denser area. That's going to be the dense irregular, and then the transition as we shift to the more loose irregular. Now, let me see where we are. Probably maybe end of Thursday, Friday, when we talk about the uterine cycle, we'll be talking about the changes that the endometrium undergoes as a result of fluctuating hormone levels. But I want to talk about the two layers of the endometrium and their blood supply. So skipping ahead a couple of slides. The blood supply to the uterus comes from the uterine artery, and that's a branch of the internal iliac, which I recognize we haven't done cardiovascular system yet, but the aorta descends down along the abdominal wall. This is kind of for free, just to explain what we're talking about. At the pelvic rim, it divides to form common iliac arteries. The internal iliac artery goes down into the pelvis, and its branches will supply the bladder, seminal vesicles, the lower portion of the rectum. Yeah, and the rest of these will pass into the lower extremity as the femoral artery. Okay, so this is the internal iliac right here. And then it's named for the branches, so we have middle rectal artery. We even have an internal pudendal artery. And so uterine artery is present in the female, of course absent in the male. So running out the size of the uterus, and I think I have an earlier slide that I didn't, oh, this one. Oh, that earlier one. there's a vaginal artery, and then there's the uterine artery coming in here that runs up and also helps to supply the ovaries. And so the uterine artery runs along the uterus, and then it sends branches into the myometrium. So within the myometrium, we have an arcuate artery. Branches from the arcuate artery go up through the myometrium to the endometrium. And I have a diagram, a slide as well. These are known as radial because they radiate in. And this would be the end of the myometrium. And then within the myometrium, they grow long, and after ovulation they grow even faster than the endometrium is growing, and they become highly coiled. So these are known as the spiral arteries. Okay. When we look at a side of the endometrium, what looks like the spiral arteries are really the glands. But I made up some pictures here to illustrate. So out here's the uterine artery. And then we have the arcuate artery sending the radial arteries through to the endometrium, and then spiral arteries. Okay? So during lab time and during break, I made up a new set of slides to illustrate this. And unfortunately, the picture's not quite as in focus, but down here's the myometrium. Where the yellow line is, the endometrium starts. Okay?
Can't tell the difference too much.
Between
the two.
the endometrium is going to have the glands. Okay? And then when we go back to the other slide that's in your PowerPoint online, it'll make a little bit more sense. So yes. Arcuate means it's forming an arc around the entire uterus. Radial is radiating towards the uterine cavity from that. It's a branch. The radial is a branch of the arcuate. All right, so where the blue dotted line is a delineation between the stratum basalis, which is the deepest layer. It attaches the endometrium to the myometrium, and the stratum functionalis, which is the superficial layer. The stratum basalis is always there. Yeah, amazing. And then depending on the level of hormones, when the menses occurs, and we'll talk about the hormonal changes. So for now, this is for free in the sense I'm just explaining what's happening. After ovulation, a hormone released by the cells around the ovaries known as progesterone. It's part of birth control pills, so you may have heard of that. It is the highest level. It's higher than estrogen after ovulation. Estrogen is higher before ovulation. Progesterone barely exists. After ovulation, progesterone levels climb, and their function is to increase the rate of growth of those spiral arteries. Estrogen's function is to increase the connective tissue and the glandular tissue. Both of those are required to maintain the implantation. So when the embryo implants, it's going to need nourishment. So we are making a nest, basically, for the embryo. Pardon?
So the functionalis is
Yes.
the nest.
That's what the stratum functionalis is. If there is no fertilization, there will be no implantation.
So it has a function.
The progesterone levels drop precipitously. Without progesterone, those spiral arteries in the stratum functionalis constrict. Without their oxygen, the tissue of the stratum functionalis starts to die. And that separates at the stratum basalis level. So menses, which occurs about 5 or 6 days later, is not just blood, but it's all this stratum functionalis tissue. All right? The glands, you can barely see there. I've drawn them in here. They're invaginations of that simple columnar epithelia. And again, after ovulation, they become filled with glycogen. They're uterine glands, and they become filled with glycogen again for nourishment of the implanting embryo. Notice that, let me put the arteries in next. So this would be the arcuate artery. Here would be the radial artery. And then these would be the spiral arteries, and my little mouth wasn't working very well, but anyway. And so, under progesterone, this grows so much more rapidly. The uterine glands grow too, and they're coiled. And that's what we're seeing here in the uterine glands. But these grow very rapidly, and then everything after progesterone levels drop, this is what happens. Stratum functionalis is lost. The vessels bleed into the uterine cavity. And notice the base of the uterine glands are still present. So then as we start the new menstrual cycle, a repair occurs as these cells multiply and cover over the surface of the very sparse amount of stratum functionalis that's present. That comes from the uterine glands. And then, under influence of estrogen, in the first 2 weeks before ovulation, this starts to grow thicker. So that's the uterine cycle that we'll refer back to that occurs under influence of these hormones. So this slide right here, here is the denuded, here's myometrium, here's stratum basal, no stratum functionalis. All right, no epithelium even. Just some of the glands. Here, the glands have grown back over and replaced the surface epithelium. And then we see an increase. Again, these are the uterine glands, not the arteries. Those are too small. And this would be after ovulation when all of those are growing very rapidly. So we'll go through that cycle. But the endometrium has those two components, stratum basalis and stratum functionalis. All right, now let's look at the vagina. May I erase this board? You guys okay with